Good evening, dear colleagues. I would like to open our session. It will be expert dialogue. More accurate, I will perform interview with Professor Benetos. It will be dialogue about how to maintain serious citizen health and active longevity. We want to live longer, healthier life. Milestones in people's lives are shifting more and more. I mean, age of first childbirth, age of marriage, retirement age, mortality, etc. And the age criterion is blurring. The attitude to longevity is being revised. The older generation is already an economic asset, not a burden. If we're lucky enough, we too will become old. Russia, having entered the period of a demographic hole, is implementing programs for active aging. The main goal for us is a life expectancy of 78 years by 2030. The key question today is how to improve healthcare for senior citizens and to prolong longevity. Today we will discuss these questions with Professor Athanase Benetos. I would like with pleasure introduce Professor Benetos. He is Professor Benetos, full professor of internal medicine and geriatrics, and chairman of geriatrics and clinical gerontology, senior researchers at the France National Institute of Health and Medical Research at the University of Nancy. Professor Benetos is the president of European Geriatric Medicine Society. Moreover, Professor Benetos is my friend, is our friend. We have been collaborated for a long time. I am grateful to you, Athanase, for agreement to participate in Gaidar Forum. I am happy that you found time in your tough schedule. I know that you have very tough schedule for this meeting. Thank you. And my first question is, what challenges does aging population in developed country face with? What is healthy longevity? What challenges do silver-aged people face on their way to active aging? Please.
First of all, thank you very much, Professor Tkacheva, for this invitation, for this kind introduction as well. And of course, it's a pleasure to meet you again and all the group of geriatricians of Moscow. It's a real pleasure, and hopefully we'll be together really in a few months. I hope so.
Yeah.
So this is your first question is very important, because we know that life expectancy increases all over the world, and especially what happens in these years, these last 20 years, is that there is a very important increase in life expectancy after a certain age. For instance, after the age of 80, once arrived at that age in France, a man has in front of him 11 years to live after the age of 11 at mean. And the lady, she has 13 years to live at mean in front of her. So many of these women will live much more. So these are a very important increase in the population over 80. Presently, it's about 5 to 6% all over Europe. And in very few years, in 20 years, it will be 10%. So the question, of course, you ask me is, okay, we live longer. we have a great, bigger life expectancy, longer life expectancy. But the question is, how many of these years will be disability free? How many of these years will be active years in order to get a profit of the society, of the family, and so on? So this is one of the big challenges of our societies. It's a challenge for us, physicians, but it's a challenge also generally for the society. We have, let's say, globally, you can say that we have to assess the functionality of each person, and based on these assessments, to be able to offer proposals, to offer services, to offer medication sometimes, to offer more, let's say, friendly cities and friendly regions in order to live. So it's very, I think in the discussion we'll have these exchanges, but this population is very heterogeneous. So we have to assess the level, and of course, what we will offer, it's not the same for all people of advanced age.
Thank you. I absolutely agree with you, Professor Athanase. But what do you think about new term, successful aging? It's not only physical health, social financial stability. It's career, education, it's fashion, it's development. I think it's a new term for our future life. Yes. Thank you very much. And the second question is, today at the Gaidar Forum, many urgent economic issues are being discussed. So, from the point of view of economics, extending healthy life expectancy is getting more and more actual for all countries. Russia is not an exception and also set such a goal. How, in your opinion, we can shift the perception of the elderly from the burden to the asset? And how can we effectively use this asset to economic benefit? I know you are a doctor, you are not economist, but maybe you will try to answer to this question.
Let me get the medical, let's say, perspective of that question, because of course it's a very complex and interesting question. And well, let's say first of all that longevity, it's what we want for us, it's what we want for your parents, for your, or loved ones around us. So this is also, we have to understand that this is a sign of the progress in social issues, in medical perspectives. It's the fruit, it's the result of all this progress, this longevity, and it's what we want, as I said, for us. So we are, we all like when our parents, for instance, are able to play with our kids, even with our grandchildren. When they can transmit their experience, say all these stories about their lives. This is a huge wealth. It's something that's very rich. So I would say I agree with you, because there is also the purely economical issues, but this is the product, the fruit of the progress, is what we want, and this contact of the different generations is something extremely important. So for our societies, is a source of wealth, and we have to appreciate that. So it's more than economical, let's say, profitability. But in addition of that, it's very important to say that, taking into account that there are some difficulties and some problems, because for sure, persons that are at advanced age, let's say, are less fit, most of them, than when they were much younger. Okay, so what does it mean? This means that in order to keep this very important thing, our societies have to adapt the social system, the economical system, the medical system, the architectural system, how the houses are built, meaning how the cities are constructed and organized. So this is very important. I could tell you something very personal. I really believe that the way in which a society takes care of the older, the most frail people is one of the stronger indicators of the level of civilization of this society. I think we have to point out this extremely important topic.
Thank you very much for your answer. It's a good point. I would like to underline one more aspect. Indeed, a number of economically active population among aged people is getting bigger. Purchasing power of aged population is increasing as well. It's important for economic as well, yes. And on the other hand, we need to connect different generations because of solid experience, knowledge, and of wise aged people is precious. It is very difficult to calculate in real figures. Yes, thank you very much.
If I can add just one thing from the data, the French data, if you take the population of over 80 and plus, two-thirds, 65 to 70% of these population, 80 and plus, are almost completely autonomous persons. I mean, they can go out, they can go, I mean, have an active life, they have contacts, they transmit their experience. Many of them give volunteer, I mean, work. So this is, of course, some of them need more help, more assistance, but this is also normal for our society to help and to assist those who are the most frail among them. But the majority remain still active, and the society has to give them the opportunity to profit, to get more profit from their experience and what they know. Thank you.
It's really transformed from burden to asset, yes. We can proceed to the third question. What is the role of the government in this process? What programs aid at ensuring and maintaining health among senior citizens are being implemented in developed countries? Are you familiar with the best practice, new approaches in this field?
Well, again, I will speak as a geriatrician because this is what I know more and not from the other points of view. But I already have said that the society has to, at the same time, give the opportunity to the most active persons to have this transmission to the younger generations, to have the possibility to have exchanges between generations, and they can really be and they are very profitable, let's say, to the society. And at the same time, the society, as I said, has to adapt its structures and provide possibilities and opportunities to these persons to have access to the services. And of course, again, it's very important. Yes, some of them will cost to the state, to the cities, but this is normal. Now, from the most, let's say, medical point of view, how the society, our governments, the politicians and all the structure of society can help that. It's from the medical point of view, let's say there are, I would say, three things. The first is to have a structured geriatric specialty. This is very important. And we need to have doctors, physicians that are really experts in geriatric medicine. The second important issue is to give some knowledge, basic knowledge of the geriatric concepts and practices to all health professionals. Because most of the health professionals have to manage and to care older people. So they have to have some basic knowledge, not only, of course, the geriatricians who have, the experts. And the third issue is, of course, to develop in each big hospital and in peripheral hospitals, mainly the big hospital, geriatric units. Geriatric unit means two things: beds with acute beds, rehabilitation, long-term care beds, but also mobile units in order to assist and to help the other specialties to take a better care of the older people with the geriatric problems. And there are many issues, especially in domains of cognition, orthogeriatrics, oncogeriatrics. This is very important issue, but generally we have to have these centers, geriatric centers in the hospitals, and the connection of these centers with the community, the general practitioners, the other specialties, the nurses. All this continuum is very important in order to create like a network to ensure the continuity and the globality of the geriatric approach.
Thank you. It's very important issue and good point, especially because geriatrics is relatively new sphere for our medicine, a relatively new field for our medicine, and now we are creating geriatric system, as you know, very intensively, 3 level of geriatric system and geriatric center as well, geriatric beds in the hospital and the geriatric office in outpatient clinic. We try to do this very intensively and using your experience, your knowledge. Thank you very much, because you take part in our educational program for a long time. Thank you very much. And what do you think about problem ageism? It's actual problem for France. What do you think?
You know, it's a term that first we have to explain. I like this term if I explain it like that. You identify someone according to his or her age, which is, well, it's an information, this is good, but if you classify someone according to his age, especially I'm talking about the medical issues, you can make enormous mistakes. I give you an example. You're a geriatrician, you know, of course, that, but I will give an example for everybody here in this meeting. You may have 2 persons of, let's say, 83, 85 years old, same age, 2 men, let's say, the same gender, same type of diabetes, same severity of diabetes, okay? Same complications of the diabetes, let's say, all that. And you will say, okay, these are old people, so for old people I have one strategy, but for young people, a 78, I have another strategy. But you may have 2 persons of the same age with completely different functionality. So in that case, if you don't evaluate the functionality and did you make your judgment on the age alone, you may be completely wrong. And so this is one part of the ageism. The other part is to say all the older people, as you say, it's a kind of burden. So, well, we like them because they are here and we have to be gentle with them, but we will not provide the best medicine, we will not provide the best care, because anyway they will die. Well, one thing is sure, that we will all die. So this is the only thing that's sure, but the rest, I think it's not acceptable to use this kind of dogma and this kind of approach. So we try to take into account the age, because of course when they're older, we may have more problems. This is a probability, it's like that. But when we are doing a detailed analysis of each person, we can adapt our strategies, therapeutic, diagnostic, according to what can be the risk to benefit ratio of each strategy.
Thank you. Good point. And we are going to the next question. Next question is: what are peculiarities of medical care specifically for the elderly?
Yeah, well, it's a little bit related to the previous answer. Well, let's say schematically, when you see a patient, let's say a young one, whatever, a patient, middle-aged patient, normally you see what's the problem and you try to find a solution. This is the basis of the medical approach. Okay, well, in the people, when we are getting older, and as I said, from the probability point of view, we have more problems and more loss of functionality and the autonomy and so on. In this case, you have to take into account, in addition to this first consideration, what is the problem to resolve, two other major issues. The one other issue, so it's which are the comorbidities and the other medications, because we are very often in a context of multimorbidity and multimedication. This is one. And the second is, what is the general functionality in terms of physical functionality, cognitive, depression, psychological function, and social also functionality.
It's more complex approach, yes? More complex, more wide.
We have to take into account all these three circles, okay, which have interconnections in order to choose these the best solutions. Taking into account only the problem, let's say hypertension, let's say diabetes, let's say chronic pulmonary disease. If we don't take into account the two other circles, the two other parameters, we cannot manage, take care and help medically the older people, especially the most frail among them.
And the next question, geriatrics. Again about geriatric, because it's very important, believe me, it's very important for us to raise this problem, this topic in our country. Geriatrics, like pediatrics, is a specialty requiring an interdisciplinary approach. Since the beginning of the implementation of the Demography National Project in Russia in 2018, we acutely feel the problem of interdisciplinary interaction and devote a lot of time to consensus and engaging different specialists. How do you solve this problem?
Well,
because we have Minister of Health, Minister of Social Protection on the federal level in every region, yes, and that's why it's very difficult to connect this different part of system.
Yeah, this is also true, in France. For instance, the most medical issues is directly the central government and their agency all around each region, whereas the social issues are more in an autonomous way, the regions or the departments. Anyway, but let's talk about interdisciplinarity in terms of our relationships with the other professionals. Well, let's start with let's say a principle. Interdisciplinarity is complicated sometimes for many reasons, but interdisciplinarity in the management of a geriatric patient is necessary. We cannot, let's say, do not do it. So we have to do everything and to do that. And what we are talking about interdisciplinarity is many things. It's one among physicians of different specialties. We have to work with the cardiologists, we have to work with orthopedists, we have to work with oncologists, and so on. Second, it's an interdisciplinarity among different professions. You cannot manage a patient and do this, what we call the continuity of the care, if you don't collaborate with the nurses that are in the networks in the city, with the GP, but also with the physiotherapist, and also with the speech therapist, and so on. It depends on what we need, okay, or oral health specialists, and so on. So this, otherwise, we cannot do it. They need us, we need them. I mean, this is a connection. Mm-hmm. Many times, the geriatrician may coordinate that. Some other times, the general practitioner will coordinate that, and the geriatrician comes as an expert. So, but for sure, we need this kind of mixture of specialties. Otherwise, you know, if we try, let's say I work and you work in the hospital. Okay, we see a patient after a fall, after a stroke, I don't know. And we try during 10 days, 15 days to find to improve his or her health. And this person after that goes back to its environment. So if there is no continuity, if the physiotherapists in the city, if we don't work together with the nurse, the networks and all that, this person very few time after will have new problems and related to his previous situation, and we will go back to the, it's useless what we have done. So it is very important. And we have to find solutions. And also we have to be helped by the states, as you said, because they have to harmonize also the different structures that we deal with according to the problem and the situation. You're right. Complicated, but necessary.
Yes, thank you very much. Absolutely agree with you. And we have enough time for discussion. Very important geriatric problems as, for example, falls and fracture, dementia, vaccination. And the next question is, we in Russia also try to take into account the opinion of each specialist and work out a common solution in geriatric team, for example. In particular, this topic is widely discussed within the framework of the so-called set of measures for the prevention of falls and fracture among elderly. Can you share your experience of developed country in implementing such program? How long did it take you to progress? I mean, time from fracture to operation, support and rehabilitation after operation, and coordination between orthopedic specialists and geriatrics and social care service and so on. It's very difficult to connect all this service together to decide to solve this problem. How you solve this problem?
How much time do I have for that answer? Yeah, I cannot answer all these questions, of course, in the few minutes we have. But let me tell you two approaches. One is the preventive, and before the fracture happens.
Preventive, if very important.
And I think it's the most important, actually.
Yeah.
You know, let's say if we are talking about falls. The prevention has to be even to prevent falls, because we know if one person, especially after age 75, 80 or 85, starts having falls, one fall will lead to another fall for many reasons, because people develop also a fear and they walk very, very little, very badly, they have gait problems, and they are more and more hesitating because they are afraid to fall again. And so there is a vicious circle. And if you start like that, and if you don't try to prevent very early that, most of the time it's very late. Even if there is no fracture, even from this process of fall, less walking, gait problems, and so on. So our first concern is how to detect early older people with gait problems and high risk of falls. One rule is, even one fall, needs always investigations from a geriatric point of view. It may be simple problems sometimes, just the foot is not in a very good shape, let's say, or many other problems, so you will not develop now. It's huge, I mean, a big number, but we can detect that, we geriatricians, and we have to do that very early. We have very good tests for that, okay? So this is the first step. Then sometimes happen the falls. We have someone who had a fall. We have after the acute phase, let's say there is no fracture, there is no trauma major and so on, we have to send him for a center to do some exercise to learn how to stabilize his, his view, how to stabilize his eyes, his gait and so on. And sometimes if we have major problems, to do rehabilitation. Now, there is another issue, as you said. Well, some people have fractures, many fractures. And so this is a very important domain also, because, as I said before, we need to work so with the other professionals. I said the physiotherapists, I said the rehabilitation doctors, but also with orthopedists. And if someone, of course, after a fracture, it's an acute situation. We cannot say, we will do evaluations and we'll see later. So it's important to treat this person, if there is indication of surgery, to treat him and or her very quickly.
Yes, of course.
Yes. So the patients arrive to the emergency room. In some centers, they have already a geriatrician in the emergency room. He will not delay the operation or whatever, but he knows that someone arrived, and right after the operation, many of the patients, after the acute post-operative period, very, very quickly they go to the geriatric department. Very quickly, because first of all, when we see the patient just before and to have some elements from his history, even before surgery, we can say we have more risk for delirium, we have more risk for malnutrition after that, and so on. So we prepare, and he will come very early after surgery to our department to take care of all these problems in order not only to have a good result from the bone point of view, but the patient to be able to leave the hospital as soon as possible, because one day in the hospital, it's more than 5% loss of function every day. It's a tremendous problem. So we have to mobilize people, make them leave the hospital as soon as possible, and follow them up later with the connection with the community. So it's very complicated. And of course, the prevention is the base if we want to really improve things and avoid many, many falls and the consequences of falls and many fractures.
Thank you very much. And it's very important, prevention of falls and fracture, treatment osteoporosis maybe, and urgent operation after fracture. Yes, patient with fracture. And I would like to discuss problem of vaccination, especially during COVID epidemic situation. I mean, not only vaccination, coronavirus vaccination, it's pneumonia vaccination and other variant of vaccination. What do you think about it? What examples you can show?
Well, today, by far the most, let's say, hot topic is the COVID-19 vaccination,
Yeah.
for sure. Let's say very briefly for the other vaccines, the flu and the pneumococcus, I really think that these are useful vaccines, and most of the people here in France, older people who are at high risk, most of these people have their vaccines. And well, it depends, some years the vaccine is more efficacious than other years, and globally it's something that we know. But the big question now is about COVID-19, and you may know that these days, we started vaccination in France 10 days ago, previous Monday. So 10 days ago, we started vaccination. We started with the very old people. We started in the nursing homes, and the physicians and the other personnel, health personnel, in this geriatric structure. So we got the vaccine, most of us, and I think that in the present situation, there is no other solution than to propose the vaccination. We have to be clear. First, this vaccine, we use the Pfizer vaccine, but I think there are several other vaccines that have shown similar results, very good results, and very, very few side effects. Of course, we don't know that for years because it's new, but the so far results are very positive. And in the present situation, especially in my region here, we are in the east part of France. We are, let's say, with the highest levels of the disease, with a lot of victims, mainly among the older people, but also middle-aged people, younger people as well, much less, but it's also important. So there is no other solution. And this is what I say to all people who hesitate. We have, of course, to respect for these very old people some counterindications. For instance, if there is an acute major inflammation, we have to postpone for a few days the vaccine. If someone got the disease, COVID disease, with symptoms the last 3 months, we have to postpone vaccination. But otherwise, and of course, if someone has an anaphylactic shock in the past, for other reasons, we have to avoid the vaccine. But all other persons, especially the most vulnerable, should get the vaccine. You know, it's very well tolerated. I got it 10 days ago. I feel great. And most of our patients in the hospital, especially in the long-term care and the rehabilitation departments, are vaccinated. We didn't have any major problem.
Yes.
So I don't know what's your experience in your country. I know that you started also.
We started vaccination some time ago as well, and in Moscow we started vaccination in nursing home as well, and now we vaccinated already approximately 9,000 residents of nursing home. It's a very important project for us now, and we will develop this process as you. But what about another form of vaccination? I mean, vaccination against, for example, pneumonia or another infection disease in previous time. What you experienced? What problem did you have?
Well, you know, let's say for the flu is what we use most. The pneumonia also most of the reasons. So we don't have, let's say, we don't have important side effects. Clearly,
Yeah.
the problem with especially the flu vaccine.
I mean, psychological resistance to this vaccination,
okay.
anti-vaccination mood. I mean.
Yeah,
Yes.
you know, in each country, I will tell you, in each society, there is a small part of the population that always think that there are extraterrestrial forces, or, you know, each one with his ideology and everything is bad due to the Americans, to the Chinese, to the Russians, to the people of the French. I don't know. So these are conspiracy people would say that all that is to sell drugs and so on, but it's a small part of the population, okay? And they will be always against everything. But the vaccines, it's true that there are also some very logical persons, and I respect them. I mean, a big number of persons that say, okay, but do we know if really these vaccines will not have problems later for me, or when we give vaccines in young persons, what will happen 5 years later? So there is a part of the population which is very good, I mean, okay persons, not like crazy guys, as I said, the small groups. And these persons are reluctant, are skeptical, and sometimes they say, I will not get vaccine. But in all people, this percentage is very small in France. Of course, I repeat, this percentage is higher of people that they say, but we don't, it's true, for COVID-19, we don't know what will be the result maybe in 1 year, whether there will be some, we don't know that. But we have to we are responsible persons. as physicians and health professionals. I mean, we have also our opinion. I mean, it's important also for the general public. And what I'm saying is that in the present situation, first of all the data we have so far, I insist, are really very good in very large populations. And from the studies and from the million of persons who got the vaccine so far during the last 5 weeks, around 5-6 weeks, okay? So that's very good. So, of course, it's new. We don't know what will happen in 2 years, but we know globally that vaccination is the only solution. The eradication of all pandemics in the history of the humanity, not all, but most of the epidemics is due to the eradication is due to the vaccines.
Yes.
Let's be clear. So
absolutely.
This is why I'm saying, and even if for the flu, to go back to your question, some people say, yes, but I got the vaccine and I had the flu. Yes, because we know the vaccines against flu, they have to change every year because there are mutations.
Yeah.
So, and possibly in 1 year from now, we will have to get new vaccination against COVID, and maybe somehow different. But if we had the choice, and if the pandemic was not there, we could not get vaccination, but now we have no other choice. And I think it's a good choice.
What percent of elderly people were vaccinated? I mean,
I can tell
not
you,
coronavirus infection in France.
I can give you the first numbers I have from our region here. There are very few people that they are against and they didn't consent, because in order to get vaccination here, you have to give oral consent, and if you are not able due to your mental status, your cognitive status, or other, family or tutors have to give their consent. Otherwise, we don't vaccinate people. So it's not obligatory, it's not mandatory. What I can tell you from the numbers I have in our region is that the people or the families and so who were against, it's not more than, it's less than 5%. It's very few. Some say I have to think a little bit more, give me some more time, but especially for their parents, the older people, they say yes, 95% they say yes, we agree. So at the beginning, I was afraid that we would have much more negative answers, and this is not the case. This is very good. This percentage is of against vaccines will be higher if you ask a younger population themselves. It's for sure lower. I don't know. I don't have numbers. Maybe it will be 25-30% of people who will not agree to get vaccination. Maybe it's possible.
Because it's prevention not only infection disease, but cardiovascular events as well. Yes, stroke and myocardial infarction and so on. It's very important part of prevention.
You know that not only COVID, but we know that flu has long-term very important cardiovascular effects.
Yeah.
When there was big epidemic of flu in 1 year, there is an increase of cardiovascular morbidity and mortality. COVID-19 is worse because there are many people that have today the disease, they're getting better, and 3, 4, 6 months later, they develop myocarditis, occlusion of vein occlusions, thrombosis, peripheral vascular disease. So these are immune reactions, important. So we really have to take care, to be very careful and not consider this disease for the younger people just something, a very, very light flu. It's not the reality. Even if many people, young people, remain asymptomatic. Fortunately.
Thank you, Professor Benetos. We have to finish. I am grateful to you for your answer. It has been my pleasure talking to you. Thank you for sharing your experience with us. I want to express hope that we will continue to cooperate in the field of geriatrics. Thank you for your collaboration with us. It's very, very important for us. And really, we will transform aging from burden to economic asset, and we will be able to transform so-called silver tsunami to gold wave. Yes?
Thank you
Thank you very much.
It was a pleasure to participate in this very important meeting. And
Thank you very much. Have a good evening, dear colleague.
Thank you.
Thank you.